Good day, all. My name is Uchenna Ezike. I'm doing a presentation on Ijeoma Cynthia Uduji Bronchial Asthma Foundation, ICUBA. Ijeoma Cynthia Uduji is my niece. She had her National Youth Service at Ibadan, where she was redeployed at the time. At Ibadan, she fell sick and had shortness of breath. As a non-bronchial asthma, she was taken to one hospital in Mokola, Ibadan, which was called Group Medical Hospital by her friends. However, the hospital disappointed, was not treated properly, as there was no oxygen and no even any medications for bronchial asthma. She had given up the ghost and was purportedly said to be shipped to University College Hospital in Ibadan. She never made it alive. She was declared dead at the University Hospital Ibadan. She died on October 30th, 2012. We had formed a foundation. Our mission, therefore, is for the Ijeoma Cynthia Uduji Memorial Foundation, which will be a non-profit organization, to have this kind of recurrence stopped or decreased to the nearest minimum with hospitals that are not efficient. Ijeoma Foundation, the goal is to educate and encourage children and give them signs and symptoms and educate them on bronchial asthma. The foundation will support kids and children who are serious in difficulty in their health problem. Bronchial asthma, as we know, is a very serious disease with chronic inflammation. It comes with coughing, wheezing, and shortness of breath. Triggering factors include smoking, infection like flu or pneumonia, allergens in food, pollen, mold, dust mite, all can trigger bronchial asthma. Exercise occasionally does trigger bronchial asthma. Air pollution, some drugs, example aspirin, or some beta blockers, some kind of emotional stress and anxiety can also trigger bronchial asthma. Acid reflux, some perfumes and fragrances can trigger bronchial asthma. Some weather situations can also trigger bronchial asthma. The signs you can see and some of the symptoms we mentioned before include shortness of breath and wheezing and tightness in the chest and coughing. Treating bronchial asthma, however, is for patients to know what exactly the symptoms are. Once diagnosed, remind family members that you are a bronchial asthma patient so that they will be aware when you are having problems. You must have lifestyle changes to prevent asthma attack. Some of the medications that may be used include long-acting anti-inflammatory inhaler, and then some of the rescue bronchial dilators, which work immediately, can be used to treat bronchial asthma. Be sure to keep your rescue inhaler with you in all cases. Use it to travel. Use it both in your classroom, in your bathroom, in your sleeping bed. don't leave it at home. There is at this moment no cure for bronchial asthma. This is the picture of Ijeoma during her youth service. She was saluting the nation, but the system failed her. Contacts for the Ijeoma Foundation include the names are listed, and also donations are also listed, and account numbers are listed also. If you remember and you want to share any of those stories, you can also log in and share your story for bronchial asthma. We also have here some of the pictures of our niece. Let me tell you about some of her background. Ijeoma Cynthia Uduji was born on 13th of April 1989. She's the first child of her parents, Sir Chief Anthony Ikechukwu Uduji and Lady Lolo Veronica Ugochinyere Uduji, ni Ezike. They all the father hails from Akpo in Aguata local government of Anambra State, while the mother is from Iseke in Ihia local government, this daughter of Chief Lawrence A. Ezike. Ijeoma Uduji has started her education at the age of 1 at Little Angel Nursery School at Papa, Lagos. She also attended the Mayola Nursery and Primary School. Secondary education was at Radiance High School, Festac in Lagos, where she also obtained her degree in the University of Abuja, BSc Biology. She gained admission into Ashland University, Ohio in USA to study nursing. All this was due to her love for helping humanity that made her to choose nursing program. Ijeoma had certain qualities that made her stand out and easily noticed wherever she went. She was beautiful, intelligent, and bold and outspoken. She easily made friends with people and tried to impact positively into their lives. She was very lively and generous, especially to the less privileged. A few weeks before her demise, she donated blood to the National Blood Transfusion Service, Southwest Zonal Center. Do you know what she said when she was donating it and was asked? "I did it for charity in order to save lives." She also loved to stand up against injustice on innocent people, especially those close to her. How to get involved? If you or your organization would like to host a fundraising event in support of Ijeoma Uduji Bronchial Asthma Foundation, you have the number to call. Spread the message through the email ugovera2005@yahoo.com or dumskidon@yahoo.com. If you would like to share any memory, you can also email. Let's show you the photo galleries of what the foundation have done so far. The photo gallery is not downloading at this time. Now is the activities that have been conducted so far. In May of 2013, Ijeoma Cynthia Uduji Bronchial Asthma Foundation visit. They had visited a less privileged home in Lagos, and as you can see in the picture, this is presentation in the hospital of some of the bronchial asthma equipments. While also I'll have to point out that I did visit Group Medical Hospital Ibadan, where Ijeoma originally presented. I visited the Group Medical Hospital in Ibadan on 10th December 2012, Nigeria, to know exactly what happened. On that very day, Ijeoma presented with shortness of breath. I, however, had discussed with the Deputy Registrar, Medical and Dental Council of Nigeria, Dr. T.A.B. Sanusi, who was very helpful, and I was directed to Director of Federal Ministry of Health, Ibadan. The Director, Dr. Adegun, was also very helpful. We visited the hospital in company of the President Association of General and Private Medical Practitioners of Nigeria, Oyo State, Dr. Akin Sodipo. In summary, after waiting for more than 1 hour, what we saw was scanty medical record at the hospital, documentation of what happened on that day. Ijeoma was having severe shortness of breath, and she was only administered hydrocortisone IM. No IV line, no fluid, no oxygen, no breathing treatment was given at all to Ijeoma at the time of sickness, at the time of having bronchial asthma attack. All the medical staff that treated Ijeoma Cynthia have left the hospital, including the doctor and staff nurse, Ms. Nwachukwu, for unknown reason. The medical community and the medical council have seen for themselves what happened, and all of us will be waiting to see if Ijeoma's case will be a wake-up call to keep our houses in order. Up till now, we have not had any news of the consequences of this hospital negligence.